Look at the human wrist in motion. To pull the hand backward, forearm muscles must route thin, cable-like tendons across a highly mobile, multi-directional joint. Without a mechanism to anchor them, these tendons face a mechanical failure known as bowstringing. As the muscle contracts, tension pulls the tendon in a straight line, causing it to detach and stretch across the joint like a bowstring. The body solves this using the extensor retinaculum, a pulley band that drops over the tendon, snapping it securely back. Its primary action is to firmly hold the extensor tendons close to the wrist during extension. By preventing bowstringing, this structure ensures the extensor muscles don't waste energy pulling away from the bone, maximizing their mechanical efficiency. Structurally, the extensor retinaculum is a thickened band of deep fascia located straight across the posterior, or dorsal, aspect of the wrist. It originates on the lateral side, attaching to the lateral border of the distal radius. From there, it stretches across the back of the hand to the medial side. This medial insertion specifically anchors to two carpal bones, the pisiform and the triquetral. These firm, bony attachment points provide the crucial leverage required to withstand the immense upward force generated by the contracting extensor muscles. Holding the tendons down solves the leverage problem, but it introduces a secondary challenge, routing over a dozen individual tendons through a single, tightly bound space. If these tendons shared one large tunnel beneath the fascia, their friction during complex hand movements would cause catastrophic tissue wear. To manage this, the retinaculum extends vertical septa down to the bone, anchoring itself at fixed intervals to create partitioned lanes. Look closely at this cross-section of the wrist. You can see where the green retinaculum band dips down to attach to the radius, dividing the space into 6 distinct osteofibrous compartments. Within these compartments, every tendon is isolated and wrapped in a specialized encapsulation. These capsules are synovial sheaths, which secrete fluid to lubricate the sliding tendon cables. The result is a multi-chambered routing highway designed for low-friction, high-load movement. Let's use a simplified vector map of this cross-section to trace the exact spatial arrangement of these compartments, starting on the lateral or radial side. On the far lateral edge, we find the first compartment. This space holds the tendons for the abductor pollicis longus and the extensor pollicis brevis. Moving slightly inward, the second compartment appears. Here we find the extensor carpi radialis longus and the extensor carpi radialis brevis. The third compartment sits right next door, housing a single distinct tendon. That is the extensor pollicis longus. Segregating these groups ensures that the extensors controlling your thumb and those controlling your wrist can fire independently without physical interference. Moving into the central region of the wrist, we hit the widest and most densely packed tunnel, compartment 4. This compartment houses the multiple tendons of the extensor digitorum, as well as the extensor indicis. Before moving on, note the critical neurological wiring situated deeply beneath this central tunnel. That is the posterior interosseous nerve, a branch of the radial nerve that supplies this dorsal region. Continuing outward toward the ulnar side, we find the fifth compartment. It contains just one tendon, the extensor digiti minimi. Finally, on the far medial edge, situated directly over the ulna, is the sixth compartment. This serves as the route for the extensor carpi ulnaris. This complete map shows how broad muscle force generated in the forearm is divided and translated into highly specialized finger and wrist movements. Looking at this technical diagram in its entirety allows us to digest the biomechanical system as a unified whole. Every time you open your hand or flex your wrist, these encapsulated tendons are constantly sliding back and forth within tightly confined, rigid spaces. Any high-tolerance mechanical system with sliding parts is inherently susceptible to wear and tear under repetitive load. When the wrist is overused, the friction outpaces the lubrication, and the synovial sheaths become irritated and inflamed. In applied anatomy, this inflammatory condition is known as tenosynovitis. Because the surrounding osteofibrous compartments are completely rigid, they cannot expand. The resulting swelling compresses the tendons themselves, leading to severe pain and restricted movement. Tenosynovitis is the inevitable clinical cost of the retinaculum. The very structure that enables our high-efficiency hand movements also creates the exact conditions for its own breakdown.